for discussion is facial nerve pain, causes and symptoms. And for our discussion, we have with us Dr. B.G. Ratnam, Senior Consultant, Neurosurgeon at Apollo Hospital, Jubilee Hills, Hyderabad. Dr. B.G. Ratnam is a senior surgeon at Apollo Hospital, Jubilee Hills, Hyderabad, and he has experience of 22 years in his field. Dr. B.G. Ratnam completed MBBS from CMC Hospital, Vellore, and followed by MCH Neurosurgery in the year 1997 before practicing brain and spinal surgery. Dr. B.G. Ratnam has been practicing at Apollo Hospital, Hyderabad from 2004, and he is a member of Indian Medical Association. Welcome, Doctor, to our Facebook Live session.
Thank you.
Starting with our first question, what is trigeminal neuralgia means?
Trigeminal neuralgia simply means pain in the face. But funnily enough, this is not a facial nerve. The nerves which give sensation to the face is the fifth cranial nerve. It is called trigeminal nerve because it has three roots from the place it is exiting the skull. So this nerve gives sensation to three different parts of the face. So each of these branches will go to different parts of the face. Like on the top is what we call a V1 branch. Near the nose is a V2 branch. Below the lower lip, V3 branch. So three different roots of the same nerve, trigeminal nerve, gives these funny symptoms. Now this is a disease which is diagnosed usually by ENT surgeons, sometimes by dentists, and mostly by neurophysicians. This is a extremely painful disease, and it's very uncommon in younger age groups, and it follows typical patterns. The pattern is, in an age group after 55 years of age, one half of the face or one particular segment of the face will start giving extreme burning electric shock like pain. Sometimes the pain is so much that patient will get into a depressive phase. None of the common painkillers will give relief from this pain. Now the usual tests which are done for brain diseases do not give any result. So sometimes the diagnosis is made because by trial and error somebody will use a medication used for epilepsy and it gives a relief for this pain.
Next question, what causes trigeminal neuralgia?
Trigeminal neuralgia, or in other words people call it tic douloureux in French, is a name given to a symptom, it is not a disease. The most common reason why this happens is we might not find any definite proof for any particular disease as such. In about 30% of the cases we find a reason based on a MRI scan where there is a tumor, or there is a disease called demyelination of the brain, or there is some sort of viral infection in the body which got reactivated in that particular nerve root. In 60 to 70% of the patients where we do not find any reason, now we have new powerful MRI protocols which will try and demonstrate if the nerve which is near the brain exit place is touching any blood vessels. Now there are few names for these specific protocols like CISS protocol or a Fiesta protocol. Like for example, this is one of those protocols where it is showing nerve is touching the artery very close to the brain stem. This they found what we call a neurovascular conflict is one of the common reasons why this thing happens. This neurovascular conflict happens not because of any disease, but because with age there is some degree of shrinkage of brain, and the brain and other tissues tend to sag, and the vessels which are actually separate or just about touching each other will start causing some kind of indentation in the nerve, which triggers this pain. Typically, the pain is not just in any particular location on the face, and it is like electric shock, as if like a pulse going. A lot of people complain that when they touch one particular part of the face, or when the cold breeze hits the face, or when they are eating something, this pain gets triggered, like it's got a trigger points on different locations on the face.
Is it life-threatening or contagious disease, doctor?
A very good question. This is not a contagious disease. However, one of the viruses which are harboring within the nervous system can get reactivated through the nervous system and cause this. This is one of the rarer causes for the disease. Now, even though it's not a contagious disease or a life-threatening disease, it's extremely painful, and some of the patients go into extreme depression because it is not getting controlled with any medications.
Are there any tests for trigeminal neuralgia?
There is no definite test to prove or disprove the disease, because the name of the disease itself is the symptom. But however, to find out any secondary cause for causing this pain, like a brain tumor or demyelination or some kind of viral reactivation, high quality MRI scans can pick up. And also, when we suspect it is one of those conditions where there is a neurovascular conflict, we need to do the special MRI protocols which will show neurovascular conflict, which should correlate with particular side of the face and also particular segment of the face. Then the meaning of that test is, maybe if you can reduce the neurovascular conflict, the patient's pain and the symptoms will subside.
What are the treatment options available?
There are broadly two types of treatments. One kind of treatment is what we call non-destructive treatment. Second one, what we call destructive treatment. Now, the most non-destructive treatment, most commonly easily available treatment is use of medications. Some of the best medications that are used very commonly for these are actually from a segment called anti-epileptic medications. These, for some reason, seem to have a very good effect on this disease and the symptoms. And there are basically 3 to 4 categories of molecules which come in multiple brands at different doses. They seem to have very good effect on the treatment of this condition. Second most common treatment, which is low risk but of good effective in the short term, what we call through the needle. There are, what we do is, one is injection into the ganglion where it is dividing into the 3. The non-destructive treatment available for this is what we call balloon compression. In this treatment, what we do is, in any needle based treatment, a needle is inserted from the face into the skull base, and using X-rays we confirm the location of the needle. The non-destructive treatment involves putting in a micro balloon there and give pressure to that nerve ganglion which is in the skull base. Destructive treatment or partially destructive treatment involve injection of glycerol. Sometimes we give what we call a radio frequency lesioning. Radio frequency lesioning basically delivers temperature, higher temperature, and causes a minor burn to the tip of the needle. So these are needle based treatment. long term very effective treatment but slightly high risk to life are the treatments which are done directly on the brain. There also we have two categories of treatment, one which is non-destructive called microvascular decompression, where we separate the artery from the nerve and put a non-absorbable material like Teflon patch to separate the artery from touching the nerve. The destructive treatment again involves delivering heat to the nerve or causing disruption in some of the nerve fibers. The fourth type of treatment is radiation treatment. In radiation treatment, which is done with high precision using gamma knife, again it is some sort of partially destructive treatment where it causes injury to the nerve at the particular target. Now, most common treatments which are used are medical treatments. For long term relief, what we advise is a surgical treatment which is a non-destructive type of treatments are preferred.
Thank you, doctor. What are the risks associated with various treatment?
Now, non-destructive treatments, for example, like a medication, on a short term basis, they have very little or very few side effects. Like some people develop some kind of allergic to medicines, or some people develop some kind of liver or a bone marrow suppression kind of side effect to medical treatment. Fortunately or unfortunately, some of these medical treatments are very effective for the patient in the initial phases, but as the time goes by, they tend to take higher and higher doses because that's what is giving them relief, and that causes this effect on the nervous system, bone marrow or liver and things like that. Needle based treatments are usually done under sedation or a neurolept analgesia, where patient is awake and we put a needle on the face which goes all the way to the skull base using X-ray control. Now, unfortunately, any manipulation of this nerve root or fascicles causes increase in the blood pressure. So, this is done in the operation theatre, this is done under X-ray control. We need to control the blood pressure during this procedure. Even though it is not as risky as a brain operation, there is some degree of risk involved. Patient needs to have some good heart condition to tolerate this treatment. Operation, as you know, which involves opening up of the brain, and it has its own risk of causing hemorrhage, causing some degree of brain damage. But if this treatment works, which it does more than 95% of the time, the long term pain relief is the highest. So, depending on the patient's physical condition and the nature of the symptoms, we choose what is the treatment which is most appropriate for the patient.
Is there any new developments in this field?
Now, because this is little bit of a mysterious disease where we seem to be knowing some things and some things we do not know, a lot of research has gone into this over the years. Now, some of the treatments are getting modified, some of the treatments are going to be new, but right now as we talk, there are a lot of clinical trials happening. Now, these clinical trials involve 3 different types of treatments which are going. Surgical treatments are quite well established, radiosurgery treatments are quite established. When it comes to medical treatment, there are 2 drugs which are under last phases of clinical trials, and one of them seem to be having very good initial responses. Second one is blocking a greater occipital nerve with a local anesthetic, seem to be having very good initial responses. That is also getting into the late phases of the clinical trial. Now, third one type of treatment is again involves a radio frequency. This is what they call combined low temperature continuous radio frequency to the ganglion. They have a gadget which can deliver the low temperature radio frequency. That seem to be having very promising results. And one of the medical treatments, one of the drugs is being fast tracked by the FDA because the initial responses were very good.
Now coming towards our audience question, what causes the nerve to act up?
The nerve itself does not act up. So like I told you, there has to be some sort of disease which we can diagnose through the high efficiency scanning methods we have. If we diagnose a neurovascular conflict using one of those newer MRI protocols, the physical pulse of the vessel which is touching the nerve causes some kind of short circuiting within the nerve fibers, and that will start acting up as a painful stimulus to the brain. So even though the nerve is not actually getting destroyed, it is getting this short circuiting which is perceived as painful sensation.
Doctor, what is the most common treatment for trigeminal neuralgia?
Most common treatment is a medical treatment. That is also a very good diagnostic kind of test. Unfortunately, the facial pain is not, all facial pains are not trigeminal neuralgia. There are other neuralgias. Sometimes there are headaches which involve the part of the face. There are pains in the neck which can involve part of the face and head. Sometimes people get confused thinking this is trigeminal neuralgia. So they do this trial of giving this anti-epileptic medication containing carbamazepine and his various analogs, and trigeminal neuralgia usually responds very well to this. So it's almost become like one of those diagnostic tests to see if this is trigeminal neuralgia.
What are the home remedies for facial nerve pain?
Unfortunately, there are no home remedies. Since we know this is triggered by touching the face, a lot of patients on their own develop a way of cleaning their face or washing their face. Some people try to cover up their face whenever they go out in the cold breeze, because cold breeze can trigger this very severe painful episodes. The regular painkillers which work for the rest of the body do not seem to be working for this particular disease. It requires specific medical treatment, usually 1 or 2 drugs. There are people who use high doses of these drugs in multiple dosages per day just to get relief from the pain. So that becomes one of the indications for using a second modality or a third modality for treating this pain.
Coming towards our last question, Doctor, could you please tell our audience about the facilities provided at Apollo Hospitals, Jubilee Hills, Hyderabad?
Apollo Hospital has a very comprehensive neurological and radiological setup for this. For us to diagnose a neurological problem, the basic scans like a CT scan and MRI are available here, like in most other diagnostic center. But advanced tests, MRI protocols which will demonstrate a neurovascular conflict, like a CIS protocol or a Fiesta protocol, the both are available here to diagnose, to see which patients would benefit with an operation and will have very good results because of the operation. We also need a lot of support from the anesthesia and the cardiologist usually to make sure the patient's heart is fit enough to undergo the operation or some other form of treatment. Medical treatments are available everywhere. In all outpatient clinics, the medical treatments are given. Sometimes we have to rule out conditions like a ear condition or a tooth condition, and we also need to make sure the patient is not having other neurological neuralgias coming from the head or coming from the other cranial nerves. So all these diagnostic tests are available here. Now we also do radio frequency lesioning for trigeminal neuralgia. This is particularly good for people who probably cannot withstand the risk of an open operation, but these patients will be put through this. Even though the short term results of these treatments are very good, long term treatments with this are better with an open operation. Now particular part of the face, particularly the upper half of the face, we prefer to do an open operation because it has to be totally non-destructive treatment, because destructive treatment to the upper part of the face can damage sensation to the eye, which is not good for the long-term vision. Now, the radiation treatments, gamma knife is not here, but we have the other radiation modalities available for trigeminal neuralgia.
Dear viewers, we have come to the end of our session and hope we have covered all the aspects. If you still have more doubts, you can book an appointment with the doctor and clarify your doubts. Thank you, doctor, for educating our audience in today's session. Thank you for joining us. Stay tuned for more such